Segment is sponsored by University of Utah Health. Today we are diving into the complexities of substance use disorder during pregnancy. Dr. Marcela Smid from the University of Utah Health is here to share where expectant mothers can turn for help. Thank you so much for being here today.
Thanks so much for having me.
We are so glad to have you. Now, I have to admit, I had never heard the term substance use disorder before. So what is that? And what substances are we talking about?
Yeah, it's a great question. I think a lot of people have misconceptions about it. So substance use disorder is the medical term for when people are having distressing and compulsive use. So it's different than substance use, which is a choice. But once a person has a substance use disorder, it really is a symptom of the medical condition. And any substance can become a substance use disorder. Anything from nicotine, alcohol, opioids, methamphetamine. So really any substance can become a use disorder when it becomes compulsive and distressing.
Right, and it's just like you were saying, it's like it can be from the very beginning, but then all of a sudden you throw in a baby into the mix and all of these activities are supposed to stop just like that, but it can actually be incredibly difficult for the mother and even riskful to her health as well, right?
Yeah, that's such a great point. So I think most people with a substance use disorder, when they become pregnant, will either stop without any medical intervention, or if they can't, that's really the folks that have the most severe disorders and need help. And there are medical health interventions, there's medications, there's behavioral therapy that we can offer to help make that transition easier. And like you mentioned, some of them can be life-threatening. So something like alcohol use disorder really needs to be done under medical supervision, because just stopping, people can really have problems up and including death.
Well, and you guys have an incredible facility up at the University of Utah Health. Tell us a little bit about that and the options that are available to these pregnant women.
Thank you. So we have the SuperAd Clinic, which is a dedicated multidisciplinary clinic for pregnant and postpartum people up through the year postpartum, because really we don't just care about people when they're pregnant, it's postpartum. There's often that return to use is so high in that postpartum period, and that's where we see the most overdoses and the most deaths. So we focus all the way extended out to a year postpartum, and once they're a year postpartum, then we do a warm handoff to other providers in the community.
Well, and tell us a little bit about how, if there's a mother out there struggling right now, how can they get a hold of you guys? Because a lot of times it's like, it would be hard to admit, I have a problem, and then it's even harder to know where to turn to.
There's
so much shame.
Yeah, there's so much shame and stigma. And we have a clinic, this clinic called the SuperAd Clinic. So calling the clinic line, so one of our phone numbers to make an appointment, and then on the maternal infant health program website for the Department of Health has a lot of resources. It's a great, SuperAd Clinic is a great resource here in the Valley, but there are state resources as well, so that we can help to make folks be able to have those interventions in their community as well.
Right, and I'm sure you've seen so many stories of women getting through this, and I'm sure there's a lot of people that feel alone right now in this. What would you say to them?
So I would say you are not alone, that there is help, and that this is a medical condition. And I think the self-stigma and the self-shame is the worst burden, is that the worst things that people say to themselves as mothers are the things they say to themselves.
So
and
true.
It's whether it's all the things up and including substance use disorder. So it's really allowing people that vulnerability. We know that when people ask for help, they are being vulnerable, and so we hope that they can find that in our SuperAd Clinic and in the other resources available around the state.
Well, thank you so much for the work that you are doing. And one more time, where can people go for more information?
So we have on our website. So the Elevate Center is we have a maternal center of excellence, which is a research endeavor that we have that's funded by the NIH, and there's resources on there that's on our website, and they can learn about some of the innovative research projects that we're doing with rural and Native American communities as well, if you want to get involved in that way. And then there's also the Maternal Infant Health Programs website, and then the University of Utah website.
Great, and all that information is going to be on your screen. Thank you so much for being here today, Doctor.
Thank you so much for having us.